I think we can go ahead and get started now. First of all, I want to welcome you all to this month's AMDA webinar. For those of you who do not know who I am, my name is Matt Zimmerman, and I am the Director of IT and Communications here at the Acid Maltase Deficiency Association. Thank you all for joining us today. In recognition of Mental Health Awareness Month, today's talk is titled Mental Health for Pompe Disease, the Importance of Being Understood. Giving this talk, we have Heather Shorten from Pompe Alliance, Nadia Bodkin from Rare Advocacy Movement, and J.C. Muyl from Mental Health for Rare. Heather Shorten is the founder and executive director of Pompe Alliance. Diagnosed with Pompe disease in 2015, she turned her experience into a passion for rare disease advocacy. She holds a bachelor's degree in sociology and a master's degree in social work, both from Cleveland State University. Heather directs all operations of Pompe Alliance, including media communications and advocacy, and has presented at notable conferences, including the World Symposium and the World Muscle Society Conference. She's a dedicated advocate for equity in healthcare and brings 15 years of prior experience working with children and families in child welfare. Nadia Bodkin is a rare disease patient advocate and founder of the Rare Advocacy Movement, the first community-based rare disease activist network dedicated to driving systemic change. Born with 3 rare genetic conditions, Nadia has turned her lived experience into a lifelong commitment to advocacy, founding EDSers United while still in college. She's collaborated across nonprofit, industry, and academic sectors to advance therapeutic development and patient engagement, and is a strong voice for ensuring patients are empowered to lead conversations about their own healthcare. And J.C. Muyl is a healthcare strategist with over 25 years of experience spanning life sciences, digital health, and patient advocacy. In 2025, he co-founded Mental Health for Rare, an initiative bridging the gap between rare disease care and mental health support by training therapists, conducting community surveys, and building a rare therapist network. Earlier in his career, JC helped grow healthcare services company C3I from a startup into a global organization and has led multiple healthcare startups throughout his career. He is deeply committed to addressing the significant mental health needs of rare disease patients and caregivers. Throughout this presentation, you can send questions at any time by clicking the Q&A feature at the bottom of the Zoom window, and our panel will answer them at the end of the talk. The Q&A will not be included in the final video posted on our website, so feel free to speak frankly. Heather, Nadia, and JC, thank you so much for joining us today, and with that, I will turn it over to you.
Thank you, Matt. Great intro. As Matt puts the presentation on the screen, I want to thank AMDA for this invitation to share with you the work we're doing at Mental Health for Rare, especially in the context of the Pompe disease community. I think we have an hour. We'll go over what Mental Health for Rare is all about, and then we'll turn into more details about what we've heard through some of the surveys and qualitative interviews that we did in the Pompe community. And then finally, we will talk about what that means in terms of how do we integrate mental health in the caring of for Pompe patients and their caregivers as well. So if you don't mind turning to the first slide. So we co-founded Mental Health for Rare, Nadia, Heather, and myself a couple of years ago now, because we realized that if each rare disease has its own medical conditions, from a mental health standpoint, we're talking about a huge unmet need for all rare communities. So we're talking about 30 million people here just in the United States living with a rare disease, and very little is done for their mental health. Nord, who's also sort of thinking through that whole issue, I did a survey recently over the past couple of years, and they found that 3/4 of the rare communities have a high prevalent need for mental health services. So it's not just the Pompe community, it's all rare communities. And what you see on the right is some data that we captured through some of the community surveys that we've done. And we found that people who live with the rare disease or their caregivers, their family members, have a prevalence of rare disease, of a mental health diagnosis that is at least twice as much. In some cases, you'll see for the Pompe community, it's like even more than that, 2.5, but twice as much prevalence of mental health diagnostics. So this is actual diagnostics of mental health issues than in the general population. So we're talking about an acute issue with a huge population. So if you turn to the next slide, this is why we exist, and this is sort of what we do at the Mental Health for Rare organization. Um, Everything we do is based on research. So we basically go back to the communities, the rare communities that we work with, and we do quantitative surveys. This is sort of the first step that we do. So we have a questionnaire, we call that an index, mental health index, that we sort of roll out to the community. And we hear about sort of mental health at the sort of at the broad level. Then we zoom in into patient interviews. So we will see here a lot of themes coming out of qualitative interviews that we held, roughly 18 of them, with people living with Pompe, whether they be patients or caregivers. And then all of that information, we spend a lot of time talking about it, presenting it, doing posters at conferences. We have a peer-reviewed paper that is under being reviewed today. So we want to do everything that we do based on actual data. And then with that, we turn to education. So we spend a lot of time also presenting our results exactly the way that we're doing it today in this conference call, to the community itself, to the care providers of that community, to anybody who's involved in interacting with the rare community that we're working with. Um, you see there, the rare therapies training is one of the outputs of all of these activities. We'll talk about that in a subsequent slide. Is we are focused on taking all of that information, all of that content, and sharing it with therapists that are interacting with the rare communities that we work with. Then support, all of that is to sort of be actionable in the communities. So our goal is to create a rare therapist network that is trained on sort of the living conditions of people with the rare disease that they support, so that the interactions between the rare therapists and their patients are better than they are today. And finally, measuring all of that, we wouldn't want to do that and not know whether we have an impact. So our goal is to, on an annual basis, to sort of go back to the community, measure, the mental health index, so to speak, of that community, and see how we've potentially impacting access to mental health and outcomes as well. So this is a little bit about the scope of our process. Next slide. Why that matters for the Pompe community, and I think I'll take bullet points number 2 and number 3 here. These are the themes that you'll hear today on this call. Nadia will go through them. But one of the top themes with adults living with Pompe is they feel unseen, misunderstood. So essentially a lack of understanding of what it means to live with Pompe, and that has direct implications from a mental health standpoint. Caregivers are also experiencing mental health issues. What we hear from them, you'll hear that from Nadia, is their fear of living with chronic anxiety and fear about the future for the loved ones that they care for. So that's why we do what we do for mental health in the Pompe community. If you move on to the next slide. So what you see here are the sort of top line results of the quantitative survey that I mentioned we did for the Pompe community. 57% of all respondents, patients and caregivers, told us that they had had a mental health diagnosis, which is 2.5 times more than the general population. Despite that, so this is kind of a high prevalence of mental health in this population. Despite that, only 1 in 5 patients, we asked the patients, were recommended a mental health professional at time of diagnosis. So there's an issue of access. You're diagnosed with the Pompe disease, and nobody's basically offering you to turn to a therapist, for instance, to deal with the consequences. But when people actually get access to therapists and mental health support, at least one in 2 people think that the work that they did with that mental health therapist is helpful for them. It's not, we'd like it to be much higher, but it's not nothing. So you want to improve access to mental health therapists. And then the second thing that you'd like to do is you'd like to improve the actual mental health therapy itself, which is sort of the goal of what our program is about. Then the other aspect of it is that for people who didn't have access to mental health support, at least 3/4 of them would like to. So there's a need, there's a willingness to get access to mental health therapists, but it's just not talked about. And then when it's made accessible, it's not that effective, only one in two. So this is sort of what we're working on in the next slide, our mental health, therapist training program. Sorry, if you want to move to the next slide. And this is where we're at. You may have heard of this program. So we started with the surveys, which we completed back in 2024. We got 44 responses. Some of the people on the call here might have responded to the survey. Obviously, it was a blinded survey. Then what we did is we hired a firm to do qualitative interviews, and we did 15 of them. The themes that you're going to hear today from Nadia are essentially what we heard during these interviews. We've done a lot of publications and presentations. Today is just one event, but you can see here on the list, we spend a lot of time sharing what we heard and making sure that we heard right with the community itself through the Duke partnership that the Pompe Alliance has. At the World Symposium, for instance, we've submitted an abstract recently at Orphanet, and we will continue doing that. And that's not work that stops there. But the one sort of actionable output of all of that is a Pompe therapist training program, which we have at this point completed the actual curriculum and the presentation. So we have now a hour-long, 2-hour-long presentation for therapists to learn about Pompe. And we are applying for the certification as we speak of the training through NASW, which is the National Association of Social Workers. Once that's approved and certified by the NASW, we can offer a CEU, like credits for therapists that want to take that training. And the benefit there is that they need to take training to get recertified every 2 years for their license. So this would basically incentivize them to take this training because they get the credits. And we do that in a way to create, what's in it for me for these therapists. And our goal, like I mentioned before, after that will be later on this year or / early next year to actually start training therapists. So we're, hiring people to do that, training them virtually or, face to face so that they can get access to that knowledge that we've acquired about the living conditions in the Pompe community. So that's kind of where we're at. We're sort of like 80% of the way there, 85% of the way there with our program here. We're super excited to be able to make mental health training available to therapists. And the end result will be that people from the Pompe community will be able to get a list of these therapists that have been trained so that they can go to them versus going to, just any therapist out there. Moving on to the next slide, I'm going to turn it over now to Nadia, who's going to share with you 2 sets of information. The first is themes that we heard from the Pompe patient community. So these are patients that took these qualitative interviews that I mentioned. So she's going to tell you about what we heard there. And then the second section would be from caregivers, so patients and caregivers. So I'm going to turn it over to you, Nadia.
Yes, thank you, JC. So like JC said, through this research, we uncovered 9 major themes expressed by Pompe disease patients and 9 major themes expressed by caregivers. And it's important to recognize that these are not assumptions or theories. These are real themes directly from the Pompe community, reflecting what day-to-day life actually feels like. And importantly, these themes reveal just how central mental health is to the Pompe experience. Next slide, please. So when we step back and analyzed all of the data from the patient interviews, these 9 major themes emerged. These include experiences like being dismissed by the healthcare system, the constant mental load of managing the disease, grief, and identity loss after diagnosis, and a strong desire for support that truly understands rare disease. We also heard about isolation, the deep connection between physical and mental health, and the importance of peer community. So together, these 9 themes from the patient community paint the picture that mental health challenges in Pompe are not isolated issues, but rather they are woven into nearly every aspect of living with a disease. Next slide. So the first and most universal theme we heard from patients was being dismissed or not being believed. So on screen, you'll see a quote from a Pompe patient that reads, you get told a lot that so much is in your head and that there's really nothing wrong with you, or you have a mental health problem. So I absolutely experienced that. I wasn't as open-minded about having help with mental health from being just told that all things in your body are just kind of overreacted on. So every single patient that participated in our study described some version of this experience. Many spent years, sometimes decades, being told their symptoms were in their head or being misdirected towards mental health explanations before receiving a correct diagnosis, which has a lot lasting impact. Our research shows that it creates distrust, not just in the medical system, but sometimes in mental health care as well. So when we think about engaging patients in mental health support, we have to recognize that for many, trust has already been broken and needs to be rebuilt. Next slide, please. So another major theme from patients is the constant mental load of living with Pompe disease. Patients described being in survival mode, not just physically, but mentally. On screen, you'll see a quote from a Pompe patient that reads, "I go to the appointments just about every day of the week, or at least that's what it feels like. I barely look a week or two into the future. The next day is like, will I be able to go to the grocery store? I'm still kind of in survival mode." So every day involves planning around energy levels, managing appointments, navigating providers who may not understand the disease, and constantly advocating for themselves. This isn't occasional stress, it's continuous. And that ongoing cognitive and emotional burden is sometimes it's something that often goes unseen, but has a significant impact on mental health. The next slide. So, one of the more complex emotional experiences patients described is what happens at diagnosis. There's often an initial sense of relief, finally having an answer, but that relief is quickly followed by grief. So, on screen, you'll see a quote from a Pompe patient that reads, "When I think once you learn you can't do something anymore, like swimming, I can't go to the pool anymore because I have respiratory issues. So just acceptance of things that you can't do anymore. Dealing with that, I think, is important. I know some people used to ride horses or motorcycles. Obviously, they can't do those anymore. For a lot of people, those were major hobbies of theirs." So patients began to process like what they've lost, activities, independence, future plans, even aspects of their identity. And this isn't a one-time event. For many, this grieving process unfolds over years as a disease progresses. So diagnosis is not just a clinical milestone, it's also a major emotional turning point. Next slide. Closely connected to that grief is a shift in identity. Patients talked about the loss of independence, no longer being able to work, needing support, or feeling less confidence in themselves over time. On screen, you'll see a quote from a Pompe patient that reads, "It gradually just eats away at your confidence. It makes you overly aware of yourself. And the reason I say overly aware is because it makes you think of things that you never had to think about before. That's why I think it's so important to not just address your physical health. Mental health should be a necessity when you're diagnosed with any type of condition." So, this transition from who you were before diagnosis to who you are now can be deeply disorienting, and many expressed a need for support in rebuilding a sense of purpose and self-worth. And this is where mental health care can play a critical role, but only if it's tailored to this lived experience. Next slide. One thing we heard very clearly, patients don't just want therapy, they want informed therapy. So on screen, you'll see a quote from a Pompe patient that reads, "Just being a mental health professional isn't enough to establish trust. It's got to be, I'm going to look that up for you, or I'm going to give you this to try. It's going to take a lot more than just having a degree." So, in essence, our research found that patients are looking for mental health professionals who understand rare disease or who are willing to learn. And for patients who have already been dismissed, trust isn't automatic, it has to be earned. So, generic coping strategies aren't enough. Our research findings highlight the importance of informed empathy. someone who recognizes the complexity of living with a rare progressive condition. And ultimately, this highlights a major gap and also a major opportunity in how we deliver mental health care. Next slide, please. So isolation is another recurring theme. Many patients describe shrinking social circles due to fatigue, physical limitations, or simply the difficulty of maintaining relationships when others don't understand the condition. On screen, you'll see a quote from a Pompe patient that reads, "It's harder to make friends with the disease, so it makes me lonely sometimes. And that loneliness makes me sad or depressed. And so I've got to help keep pushing through." So for some, weeks can go by without meaningful social interaction. And that loneliness doesn't just feel bad, it directly contributes to anxiety and depression. So when we think about mental health, we also have to think about connection. Next slide, please. Patients also emphasize that physical and mental health are deeply interconnected. On screen, you'll see a quote from a Pompe patient that reads, "How difficult every little task is for me, like rolling over in bed, picking up my kids' toys. I wish she understood that. That really takes a toll on my mental health. It takes so much energy just to walk around and be myself. When you're perfectly healthy and you can run and do all that, it's hard to understand someone who can't." So symptoms like fatigue, disease progression, or medication side effects directly impact emotional well-being. But too often, these are treated as separate domains, and patients want providers to recognize that when their physical health changes, their mental health changes too, and vice versa. Our research shows that acknowledging this connection is essential for providing truly holistic care. Next slide, please. So out of 7 patients expressed that one of the most powerful sources of support for them was peer community. On screen, you'll see a quote from a Pompe patient that reads, "That was the most therapeutic thing I ever did, going to Pompe conference. Meeting other people with Pompe face to face helped me more than anything. Just to be there in person and see that they still have a life. You have to make some adjustments, but you can still live and have a happy life." So meeting others with Pompe, whether in person or online, was often described as transformative. For many, it was the first time they felt truly understood without having to explain themselves. And that sense of shared experience can be incredibly healing, sometimes even more than formal care. And for patients who haven't yet found that community, it's something they've expressed to be actively seeking. So this theme reinforces an important point that connection is not just helpful, it's essential. Next slide. And finally, 3 of 7 patients revealed a particularly unique and heavy burden for the Pompe community: ongoing anxiety and access to treatment and financial security. So on screen, you'll see a quote from a Pompe patient that reads, "As soon as my treatments were under question, it made me very frightened to continue working, to have that be in jeopardy. I've had a few situations since then that really make me fearful to make income or have benefits. I'm fearful of anything that offers benefits because I don't want to have in question whether or not who will really cover the expensive treatment." So for individuals living with Pompe, treatment isn't optional, it's essential. And yet access to the treatment is often tied to something unstable like employment or insurance coverage. So this creates a constant underlying fear. Some patients described feeling afraid to work or to earn income because it could jeopardize their eligibility for coverage. Others talked about the stress of not knowing whether their treatment would continue to be approved. So, unlike typical financial stress, this is layered with something much more serious: the fear of losing access to life sustaining care. And that kind of uncertainty doesn't just show up occasionally, it becomes chronic. It affects decision making, limits independence, and adds another constant mental load on top of everything else patients are already managing. So this is the 9th and final theme identified by our research for patients, but it presents a powerful reminder that mental health in rare disease is not just about coping with illness. It's also about navigating systems that can feel unpredictable and fragile. Next slide, please. So because mental health challenges in rare disease don't only affect the individuals living with the condition, we also sought to understand the experience of caregivers in the Pompe community and the effect of Pompe on the entire family system. So in addition to interviewing patients, we conducted qualitative interviews with Pompe caregivers to better understand the emotional realities of caregiving. And what we heard was incredibly powerful. Caregivers described living in a near constant state of vigilance, fear, exhaustion, and uncertainty, but also resilience, love, and deep commitment to the people they care for. So, just like with the patient interviews, these themes came directly from caregivers themselves and reflect the day to day realities of supporting someone living with Pompe disease. Next slide, please. When we step back and look across all caregiver interviews, 9 major themes emerged. These included chronic anxiety about the future, the nonstop mental load of caregiving, isolation and loneliness, and the desire for mental health support that truly understands the rare disease experience. We also heard about financial strain, the value of peer community, guilt surrounding the genetic nature of the disease, strain on partnerships and relationships, and concern for unaffected siblings whose needs may go unseen. So together, these themes show that caregiving in Pompe is not just physically demanding, but it also can be emotionally consuming. And importantly, many caregivers described feeling that their own emotional well-being often became secondary to the immediate needs of the person they were caring for. Next slide, please. The first and most universal theme amongst caregivers was anxiety and fear. So every caregiver in our study described living with an ongoing sense of uncertainty about both the present and the future. On screen, you'll see a quote from a caregiver that reads, "I think it's fear, anxiety, and sadness. I'm scared about where my life is going to go. I'm worried. I'm scared about where his life is going to go because his symptoms are crazy and they started at 3 months and he hasn't had a break since. I'm scared for his life. I'm scared for everything." So, unlike a single moment of crisis, caregivers described this fear as something continuous, always present in the background. Appointments, test results, hospitalizations, or even small changes in symptoms could trigger intense spikes in anxiety. And many caregivers expressed that it was difficult to separate fear from grief, sadness, or overwhelm because all of those emotions were happening simultaneously. So, for many families, emotional distress is not episodic, it becomes part of daily life. Next slide, please. Another major theme was the nonstop mental load of caregiving. Every caregiver described caregiving as something that never fully shuts off, even during moments when they were not actively providing physical care. So on screen, you'll see a quote from a caregiver that reads, "Even when I say I'm not a full-time caregiver anymore, it's still full-time. Even when I say it's not, it's like constantly thinking about it." So caregivers described lives that had been completely reorganized around medical care, managing appointments, coordinating specialists, navigating insurance, researching the disease, and remaining constantly alert for changes in health status. Several described leaving careers or putting major life goals on hold. And importantly, many expressed that the mental exhaustion often continued long after the physical caregiving tasks ended for the day. So this isn't simply about workload, it's about living in a prolonged state of hypervigilance and responsibility. Next slide, please. Our research also found that isolation and loneliness were also major recurring themes amongst caregivers. Many described feeling deeply alone in their experience, not because they lacked people around them, but because very few people truly understood what life with Pompe looked like. So on screen, you'll see a quote from a caregiver that reads, "I think another word I'd add in is lonely. We're surrounded by healthy children and healthy family members, and there's no one who can really relate to what we're going through, no one we can really turn to." So for many families, caregiving responsibilities made it difficult to maintain friendships, attend social events, or engage in activities they once enjoyed. Others described intentionally withholding their fears from friends or relatives because they didn't want to burden them or because they felt those around them couldn't fully relate. And over time, that emotional isolation can become incredibly heavy. So when we think about supporting caregivers, connection and community become critically important protective factors. Next slide, please. So just like patients, caregivers consistently express a desire for mental health support that truly understands rare disease. On screen, you'll see a quote from a caregiver that reads, "I want someone who understands what I'm going through and the unique situation that I'm facing." Caregivers described wanting more than generic therapy or general stress management advice. They wanted support from someone who understood the uncertainty, the medical complexity, the chronic grief, and the emotional realities of rare disease caregiving. Several caregivers who had worked with therapists said they often spent large portions of sessions explaining the disease itself rather than receiving meaningful emotional support. But those who found providers with rare disease experience described those interactions as significantly more helpful and validating. So this reinforces that being understood matters and can have a meaningful impact on overall lived experiences, which is a concept that has been continuously raised throughout this research. Next slide, please. Financial strain was another major source of emotional stress for caregivers. Many families describe dramatic changes in income after diagnosis, often because one parent or caregiver had to reduce working hours or leave employment entirely to provide care. On screen, you'll see a quote from a caregiver that reads, "I have a constant worry about money and bills because our households only work when we both be here for our children, when we can both be here for our children and both be doing what we need to do. I thought about trying to get another job, but I'm too scared to mess with my CNA pay, so it's not worth it. But it's like a constant mental health problem for me." So caregivers described ongoing anxiety around treatment costs, insurance coverage, equipment needs, hospitalizations, and maintaining eligibility for support programs. And for many, financial stress is layered on top of every other emotional burden they're already carrying. So this isn't simply about budgeting or expenses, it's about the fear of losing stability in a situation that already feels fragile. Next slide, please. One of the most meaningful sources of support caregivers described was peer community. On screen, you'll see a quote from a caregiver that reads, "The families I've met at this conference, my perspective would probably still be negative without them. Now I can look on the brighter side. I'm not the only one. We can get through this." So our research found that connecting with other Pompe families helped caregivers feel less isolated and more hopeful. Many describe these relationships as uniquely validating because they don't require explanation or justification, because other caregivers simply understand. And for some families, seeing older children or adults living meaningful lives with Pompe completely changed how they view the future. The value of a peer community continuously came up throughout the interviews, providing significant evidence that peer connection doesn't just provide information, but also provides access to emotional survival. Next slide, please. So another distinct theme amongst caregivers, particularly parents, was guilt related to the genetic nature of Pompe disease. So on screen, you'll see a quote from a caregiver that reads, "Knowing that you're a carrier and that your child got this disease from you, it makes you feel guilty." So even when caregivers understand intellectually that they have no control over their carrier status, many still described carrying a deep emotional sense of responsibility. For some, this guilt resurfaced several times throughout the care journey, especially during moments of disease progression, hospitalization, or loss. And several caregivers described how this guilt affected relationships within the family as well. So this highlights an important point. Caregivers are not only coping with stress and uncertainty, they're often coping with complicated grief and self-blame at the same time. Next slide, please. Okay, so caregivers also spoke openly about the strain Pompe disease places on relationships and family dynamics. On the screen, you'll see a quote from a caregiver that reads, "You don't get this diagnosis, and then your next day is the same as before. Your whole life changes." So many described how caregiving responsibilities reshaped marriages, partnerships, careers, and family routines. Some described tension around how the process the diagnosis emotionally, while others spoke about long-term relationships changes that persisted for years. One caregiver believed the lack of early mental health support had directly contributed to the eventual end of her relationship with her child's father. And even in relationships that remain strong, caregivers described that experience permanently changed how they related to one another. Roles shifted, communication changed, and much of daily life became centered around caregiving and survival. So, this theme highlights that Pompe disease doesn't only affect the individual diagnosed, it reshapes the emotional and relational dynamics of the entire family. Next slide, please. The ninth and final major theme raised by caregivers was the impact on unaffected siblings. Several caregivers described feeling guilt that unaffected siblings often received less attention, missed out on normal childhood experiences, or absorbed the emotional stress within the household during periods of intense caregiving and medical uncertainty. One caregiver referred to siblings as the hidden casualty of rare disease. So on screen, you'll see a quote from a caregiver that reads, "If I could have wished for mental health support or psychology for anybody, it would have been for my other son. It would have been for the siblings." So many caregivers expressed concern that unaffected siblings were expected to adapt quietly while so much family attention was understandably focused on medical care and survival. So this final theme reinforces a powerful message that came across um, all of the caregiver interviews, that rare disease affects entire family systems, not just the diagnosed individual. So when we step back and look across both the patient and caregiver experiences, one thing becomes very clear. Mental health in Pompe disease is not separate from the disease experience, it's woven into it. For patients, we heard about grief, isolation, loss of identity, constant advocacy, and the emotional exhaustion of trying to be believed and understood. For caregivers, we heard about chronic fear, nonstop responsibility, financial pressure, loneliness, guilt, and the emotional weight of caring for someone they love while often neglecting their own well being. And while the experiences are different, there were also striking similarities across both groups: the need for connection, the importance of trust, the impact of living for years in a state of uncertainty, and the desire to feel understood, which Heather will elaborate on shortly. What stood out most in this research is that people were not simply asking for more services, they were asking to feel seen, to feel believed, and to feel less alone. And that has important implications for all of us. Because improving mental health in Pompe disease is not only about therapy or crisis intervention, it's about creating systems of care where emotional well being is acknowledged early, where families are supported holistically, and where patients and caregivers do not have to constantly explain or defend their lived experience. And importantly, this research also highlights something hopeful, that understanding itself can be therapeutic. So I will now pass our presentation over to Heather, who will delve deeper into the power of being understood.
Good afternoon. I just, at the beginning of the presentation, Matt mentioned that May is Mental Health Awareness Month. This year there is a theme to Mental Health Awareness Month, and the theme is More Good Days Together. And I just want to take a moment to recognize that as part of mental health and our mental health journey and seeing a mental health provider, discussing mental health, part of that discussion should be the wins and things that the good days that we have. Of course, talking about living with Pompe disease or being the caregiver of a person with Pompe disease is going to be the primary focus, but we shouldn't forget about those good days as well. So I'm going to talk about what helps adult patients feel seen, but also caregivers. And again, this information is information that we learned in the course of the survey and the interviews. And as we're going through this, also think about what helps you feel seen. So providers who ask about emotional well-being, people who check on your feelings, not just your symptoms. Families who listens without trying to fix your problems. Sometimes people just need to vent and they need someone just to show up and just to listen. Peer connections are also a very powerful thing for people living with Pompe disease, but also caregivers of people with Pompe disease. Nadia spoke about people who participated in the interview saying that attending various Pompe conferences was a very powerful thing for them. Mental health professionals who understand rare disease trauma is also very important. Clinicians who recognize the emotional stress that comes with living with a rare disease. And spaces where vulnerability is safe. So in a situation like this meeting, or when you're talking with your therapist or a clinician about what's going on, and feeling like you're in a safe space so you can share is very important. Next slide, please. What being understood looks like. I don't want to rush too much, but I want us to have time to have questions at the end, and we're getting close to the end. So not having to justify your symptoms. So you not going in to see your therapist and having to feel like you're explaining yourself so that that you are so that you feel validated when you're talking about your symptoms. You want to feel validated by your therapist. Being believed is very important. Again, feeling validated in your symptoms, in your feelings of anxiety or depression or PTSD, whatever those feelings are you're bringing to your therapist. Providing acknowledgement of the invisible challenges, the fatigue, that again, you're not feeling like you have to justify that to somebody, that this is a symptom that you experience as a Pompe patient, or this is a symptom that your child experiences, and that is acknowledged and validated. Family recognizing emotional needs. Again, family being able to show up as a support system, not always having to fix it, but just showing up to listen and to provide emotional and social support where needed. Employers understanding limitations without judgment. Again, not wanting to, and as Nadia talked about, a lot of caregivers and patients expressed concerns about their employment and what they are sharing with their employers and how that's tied to their treatment. And so again, listening without judgment, validating those feelings that you're having are very important. And community that gets it without explanation. Again, attending those conferences where you can meet people who truly understand what you're going through because they have Pompe or they're caring for a child with Pompe. Next slide, please. Sorry, I got my little script here. So the role of community in the Pompe community. Pompe Alliance supports understanding through peer connection. And again, we saw that in the interviews that's one of the most powerful supports we can offer. When people meet others who truly understand the lived experience of Pompe, it reduces isolation, and it creates a sense of belonging that can't be replicated elsewhere. Education. Education is essential when individuals and families and clinicians have access to clear, accurate information. It reduces fear and increases confidence. I know a lot of us, when I was diagnosed almost 11 years ago now, I was told, don't Google it, because the information that was available online was terrible. And we've come a long way in the education that we provide to patients. But having accurate information, reliable sources of information, it certainly it goes a long way. The mental health CEU training for clinicians that Pompe Alliance and Mental Health for Rare are working on together. This program would train not only therapists, but any person in the social work field or counselors. This would provide training on Pompe disease and the community, patients and caregivers, so that they would have accurate information that is coming directly from the community about the lived experience. Storytelling and awareness. Sharing real experiences helps people feel seen and understood. Navigation and support services helps families move through complex medical systems with less feeling less overwhelmed. Having someone who can guide, connect, and support makes the journey feel more manageable. And we see that in some of the various Facebook groups. There's a Facebook group for women, there's one for men, there's one for caregivers. And having that connection and connecting with a person who maybe if you're new to the group, connecting with someone who could be like a mentor. Pompe Alliance offers a program like that. And we found that helps to make patients and caregivers feel more supported. Next slide, please. The power of being understood. Understanding is not sympathy, it's connection. And when patients feel understood, patients and caregivers feel understood, it increases anxiety, it decreases anxiety, communication improves, treatment decisions feel collaborative when you feel like you're a part of a team and not just someone's making decisions for you. Relationships strengthen. So if you feel like you're part of a team, then you might have a better relationship with your treating physicians. People feel safer, they feel grounded, and they feel more hopeful. Next slide, please. So in conclusion, a message to adults living with Pompe disease: you deserve to be heard, you deserve to be believed, you deserve to be supported, and you deserve to be understood. Your emotional experiences are real and valid. And so when you're seeing your doctor or your therapist and you're feeling like you're not being seen, remind yourself of these short statements, because you are deserving of having your emotional experience, your physical experiences validated. I want to read you something just in closing. So as we move into the closing section, I want you to hold on to this. Emotional well-being isn't a luxury. It's a core part of living with Pompe. And when we build systems and relationships that support it, we change lives. Next slide, please. So thank you. This is the Pompe Alliance website, the Mental Health for Rare website. You can go to our websites and find out more information. You can see the poster that we presented at the World Symposium in last year. If you have questions, you can find some information at those websites. Thank you. But I would also like, if we don't have questions, I hope there are some questions, because I think this would be a great time to discuss mental health during Mental Health Awareness Month. But I hope people were thinking about what good days look like for them, what a good day looks like for you, and what feeling understood and seen looks like for you. If I may, real quick, just share a conversation that I had with some women a couple weeks ago when we talked about feeling understood and feeling seen, and we talked about family and things that conversations or situations we're in with our family that help us to feel seen. And one person said something just simply, she says to her children, I am listening. For myself and my sister, my older sister, we've got this frozen thing. So my sister is Elsa and I am absolutely Anna. And so when I'm having a hard day or when she's having a hard day, I'll text her, do you want to build a snowman? And she'll respond, it doesn't have to be a snowman. And so at that point, I know if it's me, she knows I'm having a hard day, and then we have a conversation. If it's her, I know she's having a hard day, and then we have a conversation. So if you have something like that, I would love to hear it.
Excellent. We do have a question. It says, are there any Pompe trained mental health therapists in South Florida? They live in 33418, which I assume is a zip code.
So we haven't, the training has not been approved by the NASW yet. That's where we are in the stages that JC talked about in the start of the presentation, where we started with the survey. We are now in that stage where the program is being reviewed by the NASW. So hopefully we'll be able to start training before the end of the year.
Yeah, and I just wanted to add that our ambition is to put on the Pompe Alliance website and any other websites that are relevant to Pompe a list of trained therapists. We call them the rare therapists. So and the idea would be that we would list at least one or two per state. The state license for therapists. So if you're in Florida, you could do at least virtual therapy with somebody who's licensed for Florida. So we don't have that just yet, but that's our goal, is to have that resource for the Pompe community. One thing that I would like to add is that if you know any therapists that you want to work with or you've worked with and they're sort of wanting to work with the Pompe community, let us know, because we'd like to approach them about taking the training so that we can add them to that list that I just mentioned.
And you can also subscribe to mentalhealthforrare.org for updates as they become available.
Yeah.
I don't know if you guys have talked about this already, but do you have a plan in place for recruitment for these therapists?
Yeah, good question. So one of them is to ask the community to mention, to sort of refer therapists, as well as we're just going to do direct outreach, through the NASW, through, the notion of offering this training program as a CEU credit gives them an incentive to take it. We'll just do promotion on top of that so that people are aware of the fact that they can take either free or sort of a training that can actually be giving them the credits for their license. These are sort of the recruitment techniques that we are talking about right now.
And when you have therapists on the network and you reach that point, when somebody logs on to find a therapist, will they be able to put in like filters where they could say, Pompe specific? Will they be able to kind of do that so that they'll go to the top?
Yeah, so it's a good question, Andrea. So obviously, there's 7,000 rare diseases out there, and there's got to be commonalities in terms of mental health, between certain experiences. But right now, what we're doing is community specific. So, we're diving very deep into the experience of a Pompe patient. So the people that will be on this list will be Pompe trained.
Okay.
And as we do more communities, there'll be Pompe trained, IgG4 trained, and so on and so forth. So as we add communities, but at some point we'll have the concept of a rare trained therapist, somebody who's worked with rare families, and at least they'll be halfway there.
Okay.
Yeah, the
Right.
goal is to develop enough data because this is research backed. So we're going disease specific. And then once we have enough communities, then we can utilize that all of that information, all that data to then create more generalized courses to help, advance the field of mental health.
Okay, yeah, that was my question. I was wondering if it was going to be general mental health on rare diseases and then the specifics, or if you were doing specific and then the broad.
Right.
All
The,
right.
the
Yeah.
latter. Yeah.
That
Yeah.
that's where Mental Health for Rare was born. Because we started doing this research in the Pompe community, and we thought this would be a wonderful resource to offer to other rare disease communities, but it couldn't continue through Pompe Alliance. So Mental Health for Rare was born out of this necessity, really, to provide this service to other rare disease communities, in addition to Pompe.
Okay.
And again, so the NASW is the governing body of social workers. I don't do therapy, but I have to renew my license every other year, and so I have to take CEUs. And I would really like, I really think, of course, people doing therapy for Pompe patients, this is an absolute must. But I also think if you are a social worker just working in the field, that this could be a beneficial treatment to you. I years ago when I worked in child welfare, I had a client who had a rare disease, and we removed him from dad, even though dad was doing the right thing, and that never sat well with me. And so, if this type of training could help another kid not be removed when mom and dad are doing the right thing, um, I think that would be a good thing. Um, so it is something that if you have to maintain a license that for in the social work field, this program would absolutely be useful for you too.
Okay.
Mhm.
And do you guys have like an ongoing survey that people can take, or another way that you guys can collect data?
Yeah, it's a good question, Matt. So we did the initial survey in 24, 25. So it's, sort of like a year and change ago. Um, I was thinking we want to do a second one, and we're wondering whether we should do one after, at this stage, when we've talked a lot about mental health but haven't really like put into practice, the rare therapist program, or wait until that happens. But our goal is to at some point come back to the community and ask, where are you at now with mental health?
Mm.
And also look for traces of sort of like impact of what the work that we've done. Is mental health a little bit better? Is the fact that we're talking about it better? Are people more likely to seek therapy after the work that we've done? So that's it's going to happen over the next probably 18 months, I would say.
Nice.
One of the things we also heard was parents asking if we had surveyed teens,
Mhm.
which we did not do. And that requires a little bit more, permission and things like that. But that is absolutely a group that is worth um, surveying as well.
Yeah, Heather, it's
Mhm.
interesting you said that because I actually wrote in my notes, what about teens?
Yeah.
Because
Yeah.
the teens are, adults, I feel like we reach a point where we can say, I'm struggling or I'm worried about this or this is happening. But teenagers,
Right,
their first time going through these things and it's very stressful, very overwhelming. It's a lot. And teenagers, they just shut down. They don't,
right,
it's hard
right.
to pull information from healthy teenagers, normal teenagers, let alone something, where they might be going through a sibling that was diagnosed or a parent that's diagnosed or themselves that, yeah, that would be worth visiting for sure. I did have one more question. When you said like when you're being gaslit at the doctors or even by your family or your peers, you mentioned how that feels and the reality of dealing with something like that. what can somebody do when they're experiencing that in the doctor's office or even in their own home with their parents or their sister, brother, or their girlfriends, guy friends, whatever? What's something they can do or say that could change the narrative or make that person realize maybe I'm just not getting it? Is there something that you would recommend they do?
So at the doctor's office, I think that so most hospitals have social workers,
Mhm.
and they don't get utilized like they should. I think asking for a social worker, if you are in a meeting with your doctor and you're feeling like you're that they're gaslighting you, I think asking for the assistance of a social worker is absolutely appropriate. Or reporting to the ombudsman. That's another service that I don't think doctor patients utilize enough. But also taking a family member with you to a doctor's appointment. I've taken my sister or my husband, because there are times where the doctor will say something to me and I just shut down. So after that, I'm not hearing it. And so having that support, I think, makes a big difference. With your family and friends, I think that's hard because it's hard to have the people not close, the people closest to you not believe you. So it's important to have at least one or two people who support you, who believe what you're saying about your care. Um, and maybe when you're having discussions with family members, having that person be a part of the discussion. I also think if you are in therapy and you talk to your therapist about feeling like your family is gaslighting you, if you wanted to invite family members into a therapy session that before and talk to your therapist before that, I think most therapists would be willing to have that conversation, as long as the patient is okay with it happening that way. But maybe even having something like that, if you can, like not with your whole extended family, but if, your
With the ones
spouse or
closest to you.
right.
Yeah.
And having that type of conversation so you have someone who is supporting you.
Okay, that's good advice.
All right, we are a little bit over time. So I want to thank you, Heather, Nadia, and JC for giving that talk. And before we end, I just want to say that Nadia and Heather, you both commented on the importance of peer community. And I just want to plug our initiative called Talking with Your Pompe Peeps, which is a monthly open forum support group to share lived experiences, tips, and other stuff on specific topics. So definitely come back for one of those if you're interested. Everyone is invited to join and share. And Nadia, you also talked about emotional stress, anxiety, and fear, which are forms of grief. And so the AMDA recently did a webinar called Grief and Rare Disease, and it was hosted by Lisa Kefauver. And this was back on January 15th, which can be found on our website. I also put the link in the chat if you want to get it there. On our website, it's under the webinar page in the past webinar section. So definitely go check it out if you're interested. It was a wonderful webinar. Thank you guys again for this great talk, and thank you everyone for participating. And with
Thanks for
that,
having us.
absolutely, this concludes today's AMDA webinar, and we will see you next time.
All right. Take care. Thank you very much.
Thanks,
Bye
guys.
bye.